In this module, we are going to focus on the concept of patient-centered care for LGBTQ community members.
There is no singular practice of being patient-centered. The definition and operationalization of patient-centered care differs among practitioners and is shaped by organizational and professional norms, values, and beliefs.
Whether we are speaking about patients, clients, consumers, or service users, one common understanding in patient-centered care is the idea that the person receiving care has a role to play in defining and evaluating the kind of care they receive. The healthcare professionals providing care may be experts in the provision of certain kinds of healthcare services, but people receiving this medical expertise are also experts on their own experiences, desires, and expectations. Patient-centeredness sees this knowledge as important to positive healthcare outcomes. Knowing this, we developed the QQQ modules in consultation with LGBTQ healthcare service users, healthcare professionals, and allies. We want to ensure that these voices are present in the discussion, and so in the words of Po Liberato, a social worker providing care to LGBTQ people, patient-centered care may be understood as
first, non-judgmental. I think that can mean a lot, what non-judgmental means. And what I mean by that is coming from a place of appreciating your client as the expert in their own experience, coming from a place of best intention, but also that best intention is to support their narrative and not support a larger narrative around them.
Like Poe, many authors describe the goals of patient-centered care as the provision of individualized or customized care on the basis of identity group membership, rather than particular kinds of illness. Patient-centered care supports the idea that healthcare professionals consider identity politics like culture, class, religious affiliation, ability, sexual orientation, and gender identity as they provide care. Who the person is becomes as important as what illness or injury the patient is presenting with.
The idea of social identities as an important part of patient-centeredness means a focus on the whole person in healthcare. Healthcare providers need to strive for a greater balance between a holistic understanding of patient needs with the realities of healthcare systems where resources are often in high demand. Patient-centeredness emphasizes individualized treatment plans, patient education and empowerment, as well as a collaborative approach to treatment decisions.
Lisa Jeffs, manager for a youth-focused urban healthcare initiative, emphasizes the uniqueness of patient needs and her service's response to those needs. She states,
Well, I think the issues need to be contextualized. We all have different parts of our identity that sometimes bring us privilege and then sometimes don't. They marginalize us. Sometimes, it's complicated. The looking at all kinds of barriers that people have to access and care. You have to look more closely at the specific LGBTQ issues and how even within that acronym and the more giant acronym that is sometimes used. And there's a whole bunch of diversity of different issues. So lesbians have issues that are different than gay men because there are issues around dealing with sexism, etc. Gay men often have to deal more with worrying about having this shit kicked out of them, right? If they're obviously gay, there's the threat of violence. And so the issues are slightly different, but they're slightly similar. Women deal with those issues too. But straight men don't have to worry about having this shit kicked out of them because of who they sleep with necessarily. And then you have to start adding on those other layers. So what about a young Asian gay man, and what does that mean? What about a young Muslim lesbian? How does that impact her experience of being queer? And what about someone who is trans? So there are so many different layers to the queer community. You can't just look at it without those other issues. But you do also have to look at some of the struggles that are specific to the queer community, like a couple of villains I mentioned. And I think just knowing us as well, that we're not this giant homogenous group, right?
Most literature about patient-centered care describes patients as unique individuals with unique needs and priorities, and this understanding shapes the approach to healthcare. For example, patient-centered assessment moves beyond standardization, emphasizing collaborative decision-making. The definition of the presenting problem is shaped collaboratively between the healthcare professional and the patient. Collaborative assessment and care relationships require a positive relationship between the patient and their practitioners. Therefore, relationship building and maintaining good relationships is another fundamental aspect of the care process. It also takes time, and so healthcare providers need to be prepared to invest time in the process, as well as investing in their skills and expertise.
While the concept of patient-centered care is popular, our contemporary healthcare delivery systems and practice trends, like population health processes and standardized care questionnaires, are counterintuitive within this process. Practitioners face the challenge of attempting to strike a better balance between patient needs and the availability of limited healthcare resources.
While the benefits and possibilities of patient-centered care are hopeful, practitioners may face challenges when attempting to provide this kind of service to LGBTQ communities. LGBTQ-identified people are sometimes described as members of sexual minority communities. Research indicates that LGBTQ-identified people have difficulty accessing effective health care. Some researchers use the concept of minority status to explain the challenges these patients face in the healthcare system. As members of sexual and/or gender minority groups, LGBTQ-identified individuals experience greater stress and discrimination when they access services like healthcare. There are dozens of examples that we could share with you from our research, highlighting these challenges LGBT people face as they access care across the healthcare system. We've heard about the challenges and negative experiences like homophobia and heterosexism in various contexts, like blood work clinics or laboratories, pharmacies, during imaging appointments, at physiotherapy sessions, with mental health care, inpatient and outpatient medical services, pre- and post-surgical care, and in preventative care and family medicine. We will be including many concrete examples throughout this and the other modules, but for now, it's important to consider the fact that in every area of healthcare, including the area where you work, LGBTQ service users are experiencing healthcare that's harmful and humiliating. Louis Chan, a family medicine physician, suggested that patients often reflect on the effects of negative healthcare experiences when they receive care in his practice.
I get a lot of comments from other patients before they start seeing me or find a good provider that address their needs, and they always complain about the other providers doesn't know what to do with them, or they make assumptions about their identity or assumptions about their medical issues, so that quite offended them, or they just don't feel like they belong to the healthcare system. A lot of times those patients feel quite distressed about that, and they have a very negative experience, and they may just avoid healthcare altogether, and they may not seek healthcare again for a few more years until things come up again that require urgent needs. But those issues can be prevented if they were able to get good quality healthcare early on.
The reliance on narratives within patient-centered care, while important, may create its own set of difficulties for LGBTQ patients. For many LGBTQ patients, the idea of telling their stories when they approach healthcare services brings with it anxiety and the expectation they will experience negative moral judgment, misunderstanding, or the need to educate the healthcare provider about the daily activities of their life. Some have challenged the idea of patient narratives as a neutral aspect of patient-centered care. Peter reflects on his own concerns about sharing his story and explaining his life to a new family doctor, concerns that have led him to avoid getting a new family doctor.
I think in general, and this would include my own experience, I think that it's seeking healthcare is really personal. And again, it's about that vulnerability. And so even though you understand that somebody is supposed to be professional and has a code of standards under that profession, the fact that you need to go in and tell your story again, and that describing where you might fit on that LGBTQ spectrum would be conducive to getting the best treatment and care possible. It's sometimes fearful. Fear makes you fearful because it's not always been a positive experience. So I know that for myself, I currently don't have a family doctor in Peterborough because it's just feels too complicated and too much work to have to go through that process. So I have until recently kept my family doctor in Toronto, but I'm currently without a family doctor.
Like Peter, Poe also uses walk-in clinics and sees these as an alternative to working with a family doctor. Poe shares her experiences of sharing her story with a walk-in clinic doctor.
The story was, it was a walk-in clinic, which is always the worst because I don't have a doctor, and I went in to get STI screening, and he refused to give me one because he said that unless I have a story, then there's no need for someone like me to get an STI screening. And I asked him, like, what do you mean by that, someone like me? And he read me and he said that a good girl like me doesn't need an STI screening unless I have a story. And I asked him, what does a story mean? And he alluded to like a sexual assault story. So unless I've been sexually assaulted, there's no way and there's no reason for someone like me to need a screening. And then I'm like, okay, I think I'm gonna do it. And I explained to him my narrative, and his face was, as he was writing on the sheet of paper, like totally freaked out.
Poe's story reflects this idea of the art of communication as an important part of patient-centered care. This kind of practice requires healthcare professionals to adjust their communication style according to the situation. For some LGBTQ identified patients, their stories are understood or interpreted by healthcare providers through the lens of stereotypes, as Poe suggests. So to recap, patient-centered care focuses on forming positive relationships with care recipients. Patient stories are important. These narratives tell us about patients' needs and expectations. But narratives require openness to really hearing what the patient is saying or trying to say. Communication and talking and listening together is a very important aspect of relationship. LGBTQ patient narratives can be shut down unintentionally. Patient-centered care is a collaborative process designed to reduce marginalization. Healthcare seekers and service users and medical professionals should work together to develop an understanding of the client's concerns and to develop a response or intervention to resolve the issues.